go straight across to the guests who are joining us now. Dr. Naresh Trehan, Chairman and Managing Director of Medanta, and Dr. Lee Meng Yan, who is an independent virologist. Dr. Trehan, I want to first start by asking you, is this worse than the last wave or better, and in which way?
So we really don't know where we are at right now, because we know that China has had a big wave, and it has also spread from, I mean, there are cases now in Japan, US, Europe, and numerically quite a high number. Although India has now seen very little, and there is almost no hospitalization and no fatalities. So the question basically is that, are we also exposed? Are we vulnerable? And that's what needs to be worried about, that if the rest of the world is showing signs of it. Although it is also clear that this new BF7 has got transmissibility is high, but the fatality is low, so the virulence is low. So that's why I think that we need to understand that, one, we don't want another wave coming to India. We need to have, we already have in place a very sophisticated early warning systems from all blocks in the country. It is reported directly to the health ministry. So if we see pockets appearing, like you have heard about those 4 cases which have been detected, and 3 of them have already recovered, 1 is on its way to recovery. So it's showing that BF7 is it is historically correct to say that viruses, as they mutate, they get more transmissible but less virulent.
But one of the things that happens, sir, specifically because because of your expertise, one of the things that was said that even in the last wave, Omicron was not fatal, but it did a lot of damage to your lungs, which in the longer run created complications. People suffered from heart attacks, people suffered from lung damage. What have you heard about this particular strain, the latest one?
No, it's not true that huge amounts of people got their lungs affected in Omicron. It was in the Delta wave that people got really sick. Omicron has not been that virulent, and in fact, most people recovered within the first 3 days, and we actually even shortened the isolation period to 7 days. So the virulence of this version was not bad. Now the question is the sub-variants of Omicron. Are they ever going to be more virulent, or this is time will tell? And what is China going through? We really don't have full information.
Actually, we do have Dr. Yan here with us. What is the information you're getting, Dr. Yan? How bad is the situation in China, or is the world overreacting based on a few videos?
Thank you. So first, the situation in China is very bad now, and definitely not as the government talk to the outside. So the thing is, we have seen more and more information make me feel similar like what happened in Wuhan in early 2020. For example, the outbreaks happened suddenly all over the country, and also people get more serious symptoms for this Omicron variant. For example, they have high fever, pain, pneumonia, and even the death toll is increasing. But the government is very incapable, and also they purposely control the medical resources, like don't give people the drugs, or they don't even give the diagnosis to the patients. And we have seen that although the other countries thought this would be related to the zero COVID policy, but let me tell you, the zero COVID policy was never for human health, public health. It was just a pure political policy. So we can see now, after lifting so-called zero COVID policies, the public health side didn't change much, but the thing becomes so bad, and Xi Jinping is still very satisfied about that, because the protest now is suppressed due to the outbreak and other methods. We have to be very aware of the situation happened in China, what is happening, what's the pathogens, only the new variant, or there would be something else? Is that related to more plans in the People's Liberation Army. We are all waiting for more answers.
So if anything, one only has to add a few hundred more to the official figures being given by China, given how unreliable their reporting is. One is saying that this variant is not necessarily fatal. Then why all of those images of bodies piling up in China and mass deaths?
So we don't know. You see, the things that it's being attributed to is several-fold. One is that it's a very old population is the one that is getting affected. People with comorbidities, diabetes is rampant in China, so is hypertension. And that also the fact that their vaccines seems like they were not effective. And China escaped natural immunity so far, so they are more vulnerable today. This is all specs. Nobody knows the exact facts, but we are speculating that that's what it may be. But the fact really remains, it is devastating from what we hear and what my colleague on the panel also said.
In fact, let me take that question to Dr. Yan, because these reports now that are being deliberated about how the Chinese vaccines are not effective, there is also vaccine hesitancy. Could that be the reason why you're seeing so many casualties?
So when we talk about the vaccine, that Chinese people get average 2 to 3 doses of inactive vaccine. This is different compared to the vaccines used in the United States or India. So these inactive vaccines actually have more problem because it was already proven not available during even SARS-1 period. And now we really have to concern about the poor quality of these inactive vaccines made in China, whether they will give people potential risk of antibody-dependent enhancement, which would make the symptoms more severe once people meet the variant, or what else would happen. And also, we need to think about that to give the large population in China this kind of very poor quality vaccines, what will happen when these people meet the variant? And then will the new variant, which has more characteristics, come out again? So there are a lot of things need to be answered. But unfortunately, you cannot get the real data or information from China government.
Do you think like countries like ours, where a majority of our adult population at least has been vaccinated, if not got the booster dose, that we are safe?
I mean, they are different compared to China because they use the different vaccine types. However, we cannot say that people get vaccinated from other countries like India or United States would have better immunity because first, we know that it was shown by data that the vaccines, even from the Western countries, cannot efficiently protect the new variant. And also, we really don't know what is happening in China now. China government now don't allow the hospital to give this kind of pathogen screening for patients. So we only know it could be the Omicron new variant, but what exactly happened in China, you don't know. And what will happen from China to other countries, you also don't know. After this kind of outbreak, definitely new variant will be generated. And at that time, we still need to see what would happen to people in other countries. And I have big concerns about that.
The 3 scariest words in the middle of a pandemic: we don't know.